Welcome to the workshop. We have a nice crowd in the office tonight. It's so good to have you guys here. Dr. Mike Ziegler of Monarch Family Chiropractic. Welcome to the Tuesday night workshop. And I find that this conversation around NSAIDs or non-steroidal anti-inflammatories is really a pertinent conversation when we look at how it's impacting our health and how many people are taking it. So tonight is all about just going through what the research is saying, what our government entities are saying in terms of the use of NSAIDs, and how there are more natural approaches to use outside of, I guess, this traditional treatment or modality for pain. So before we go there, I like to think about this. In any city in America, at any day, any hour, on any channel, there are commercials running on how to get rid of your pain. Of the 238 million people, 116 million are in chronic pain on a daily basis. So certainly addressing pain and understanding how pain impacts our country and our population is, I think, vital. But what are we doing to currently address that? So NSAIDs, non-steroidal anti-inflammatory drugs, they're the most widely used pharmaceuticals worldwide. The over-the-counter include ibuprofen, naproxen, diclofenac, and aspirin. More than 70 million NSAID prescriptions are written each year, and 30 billion over-the-counter NSAID tablets are sold annually. And more than 96% of those over the age of 65 have used an NSAID for pain control within the last 2 weeks. But really, NSAIDs are have the more side effects reported to regulatory agencies globally than any other pharmacological category. And I think we anticipate something that we can access for over the counter would be safe for us. Just like if we can access it in our grocery store, it would be healthy for us to consume. But what we're finding when we dive into really understanding the impacts of this drug category is that there are some serious side effects. GI bleeding, ulcers, kidney failure, higher risk for stroke and heart attacks with NSAID use. In England, NSAIDs were associated with 30% of all hospital admissions for preventable adverse drug reactions. So I think it's really understanding, if you're using NSAIDs, what are the risks associated with that, and are there alternatives to alternatives that maybe don't have the same side effects. We're going to get into a little bit of physiology, but we don't need to spend a ton of time here. But the chief mechanism of action for NSAIDs and what they do is to inhibit two forms of cyclooxygenase, which is COX for short, namely the COX-1 and the COX-2, that is a part of a pathway when inflammation is present. So COX is responsible for the production of downstream mediators for pain and inflammation. And when NSAIDs came out, the general NSAID inhibited both COX-1 and COX-2, production. And what they found was that the major side effect was it impacted the production of prostaglandins. I guess you see this in the third bullet point. It suppressed prostaglandin production, and their role is to protect the gastrointestinal tract. So when it suppressed, prostaglandins from being made, it created more irritation to our gastric mucosa. So we saw gastric ulcers and saw, this problem. And so pharmaceutical industry came in and said, well, let's focus on just inhibiting the COX-2 instead of just COX-1 and COX-2. So let's just go here. So this is showing you when our body is exposed to an inflammatory component through lifestyle, particularly the foods that we eat, corn, soy, seed oils, and animal protein, our body creates arachidonic acid. And arachidonic acid is a way that our body protects itself. And when we have arachidonic acid present, then we see COX-1 and COX-2 showing up. Now, of this, right, NSAIDs are meant to, traditional NSAIDs are meant to block both of these so that pain and inflammation doesn't show up in the body, okay? But I want to stay here for a second. So, so corn, soy, seed oils, animal protein, they're highly inflammatory. They are omega-6 fatty acids. If you hear of fish oils, omega-3s, those are the anti-inflammatory, I guess, supplementation that we typically take, or we're consuming wild-caught fish. It's high in omega-3s. And so we see that this pathway doesn't happen as often. In our history, typically it's been a 4-to-1 ratio of omega-6s to omega-3s that we've consumed in the past historically. With our standard American diet, we're up to 25-to-1. Omega-6s to omega-3s. And so there's a high inflammatory consumption of food and lifestyle, where if we're under that 4-to-1, we're managing that pain threshold.
Are there other really common things like foods available to us besides like fish?
Yes, there can be, and we can get into that, but typically like a flaxseed oil. I mean, you can do some more vegan type options in terms of trying to get some omega-3s.
I actually just bought omega-3 like plant-based, but flax, I guess, is the main answer for that.
I'm bringing this up. It doesn't, because I want you to understand that when we are experiencing pain and we're using, NSAIDs as, in a way to address our lifestyle, it's not addressing why it's there in the first place. And food is plays a big role in it. So much so that for this arachidonic acid pathway to be stimulated is to have a highly inflammatory diet, lots of omega-6s. And we eat a lot of omega-6s, 25-to-1. That's crazy compared to what we used to be. So COX-1 is always produced in the body. COX-2 is, they call it inducible. And typically that is when inflammation, cytokines are a big part of our immune system. They are a protein that comes around when immune system is under attack or a body's under attack. Carcinogens, oncogenes, mitogens, those are when cells are proliferating and mutating. So typically when that is present, far right side of the slide there, that's when you see COX-2 produced by the body, and that is more protection. We see that more cardiovascular in nature in terms of where that plays a role. So why am I bringing this up? When they found that traditional NSAIDs were impacting both COX-1 and COX-2 pathway, and COX-1, when it was inhibited, it created all these gastric ulcers and impacts the GI tract. They said, well, let's look at a new type of COX-2 drug to just focus on COX-2 inhibition. And so this includes Celebrex, which is still around, Vioxx, if anyone is familiar with Vioxx. It was pulled from the market back in 2004. Merck produced it, and they were finding that there was quite a bit of data around how it impacted our cardiovascular system, strokes, heart attacks, that sort of thing. And then Bextra, and I think Celebrex and Bextra are still on the market used. But understand, like NSAIDs, the NSAID market was massive back in 2004, $10 billion. So it was a really big industry to be a part of in terms of the money making. abilities, the profits. So what's the FDA have to say about it? This is dated July of 2015. FDA drug safety communication strengthens warning that non-aspirin, non-steroidal anti-inflammatory drugs can cause heart attacks and strokes. This is the black label on NSAIDs now. So if you follow along with me with the highlights, the risk of heart attack or stroke can occur as early as the first weeks of using an NSAID. The risk may increase with longer use of the NSAID. The risk appears greater at higher doses. It can increase the risk of heart attack or stroke in patients with or without heart disease or risk factors for heart disease. Patients treated with NSAIDs following a first heart attack were more likely to die in the first year after the heart attack compared to patients who were not treated with NSAIDs after their first heart attack. And there is an increased risk of heart failure with NSAID use. This is all from the FDA website. And yet we are still consuming tons of NSAIDs on a, an annual basis. I mean, you can go to Costco and grab these massive bottles of ibuprofen that people just want to keep just in case. And really is concerning because, yes, pain. That's why we want to support and address pain here in the office, but we want to support a more empowered and informed consumer that pain doesn't have to be your lifestyle, but it takes a lot of work and discipline and commitment to doing things that are most right for your health. And you have to do it long before you feel anything, because that's really the trajectory you're on. So that's why we talk about these workshops on a regular basis, because how can you start to make different changes and start to shift your mind and your belief systems around what you consider health to be and health care. Because in my opinion, using NSAIDs is great for gap timeframes, but it's not meant to be a lifestyle habit to address lifestyle concerns. I think that, I dated a boy in college whose mom was a nurse who put him on 800 milligrams of ibuprofen on a daily basis during hockey season to manage the aches and pains, right? For our 16, 17, 18, 19-year-olds. And this is a standard practice. So we've really got to shift our headspace around our over-the-counter medications. Just because they're there, are they safe to take long-term, right? And I just would like for you to see some of the most common NSAIDs. Again, I took this straight from the FDA website. The top one, that's COX-2 inhibitor, but these others are all the traditional non-specific. They are COX-1 and COX-2. So you have your ibuprofen, but you can see you've got Advil, children's Motrin. You got Motrin migraine, you got Aleve. I mean, I think a lot of these and ibuprofen is asterisk because they said this is in a lot of medication. Ibuprofen is in a lot of medication. And so just so you're aware, when you are purchasing or looking at getting something over the counter to address any type of pain, this can fall under multiple categories.
Why are there so many different, under the same things like naproxen?
I'm assuming it's different drug companies that are manufacturing them.
It's the same thing. Basically, they're like
it contains. I mean, that is their generic name on that left column, and their proper name of whoever manufactures it is that right side.
So it's just a company that's the same.
Yeah.
Yeah.
I guess I can't tell you exactly that Advil was made by Merck and, Aleve is made by Pfizer. I can't say that, but I'm assuming that there's just different pharmaceutical companies that are making these, but with the same stuff in them. I wanted to talk about Tylenol. I didn't get to it. I wanted to really focus on NSAIDs, but Tylenol has a very similar, I guess I was reading through it. They don't really know what the mechanism is for Tylenol. They think it's probably similar to NSAIDs, but it's different. And I think the biggest thing is some people use Tylenol and some people will use like an ibuprofen, and they'll say, well, Tylenol didn't work for me, but ibuprofen did. And the big thing I want to really bring up is that NSAIDs are specific for inflammation. And so if an NSAID does address your pain, there is an inflammatory component there. That seems like a no-brainer, but I just want to state that if you try a Tylenol or an NSAID and Tylenol doesn't work for you, then it may be a different mechanism that's creating your pain. And, you know, we can talk about these side effects of, you know, what we see in terms of, I mean, here's again, side effects of taking NSAIDs. It damages your intestines, liver, kidneys, ears, increased risk of stroke, heart attack, erectile dysfunction, deep vein thrombosis, atrial fibrillation, and poor healing. They call it side effects, but these are effects. You can't pick and choose which effect you like and which you don't. When you take anything, whether it's a pharmaceutical or it's a supplement, when you consume anything, it has an effect in the body. And we want to look at, you know, we want to always categorize, well, this is good and this is bad, but they're all effects. And so just keep that in mind. Tylenol is really on the line for how it's impacting the liver, and it's the primary choice for women who are pregnant. And there's recent research out looking at how women who take Tylenol during pregnancy, we see behavioral challenges with their kiddos 4 or 5 years old. So there's some real conversations that need to take place in terms of how we're addressing pain in our country.
Is that related to the amount you take, or like hospital use Tylenol all the time?
Yeah.
Not a surgery, first thing they do is they give you, I don't know.
Yeah.
They have, you know, they use Tylenol.
Yeah.
Is that just because it's related to that specific moment, or are you talking about stacking over long period?
A course of time. So the question was, if you take it in the moment, is it bad versus long-term? I mean, I think that, again, this is me speaking, not having done much research on it, but as I'm reading about, you know, longer you take an NSAID, the worse your impact is over time. So, I mean, I think these drugs are best used in terms of the gap timeframes, but taking them long-term, I think would be, you know, greater, you know, stress to a liver if you're continuing to take Tylenol on a regular basis. I may have something. I've got lots of things here. I'm like, oh, I could sort through it, but
The doctors prescribe this stuff all the time.
Yeah.
They can tell you how many times both take ibuprofen.
yeah. Yes, and I think that's the tool they have to help manage the pain. It's a lot easier to write a prescription than it is to sit down and really talk about lifestyle. And it takes a lot more work. And frankly, I don't think our healthcare system is set up to really address those more lifetime habits, because there is the big factor with everyone is that we can tell you to do these things, but are you going to do them? Like we know from last week, if you are building muscle strength throughout your lifetime, you are likely going to be younger and express more vitality than somebody who is not. And I loved that quote. It's over there. It's our healthcare system and the outcomes as relates to the healthcare system and what we do in terms of, the food industry, and it's just not sustainable. There's got to be a big shift, and I don't know how that can happen, except for it happens one person at a time, So I wanted to share this. This is what the research shows, or just some of the research around chiropractic and safety. And this is specific to opioid use. I think we all understand, the opioid epidemic and how it's impacted many, many people in our country. But pain management services provided by doctors of chiropractic may allow patients to use lower or less frequent doses of opioids, leading to lower costs and reduced risk of adverse effects. Now, I'll ask you, if somebody's on an opioid, that's like the highest level of pain management. So if somebody who is on an opioid will benefit from through chiropractic care? Well, somebody who has pain related to, where they're managing it with an NSAID, will they also probably find benefit? Yes, right? Chiropractic care could exert a positive impact on patients with low back pain by reducing unnecessary care, lowering costs, and improving safety. Pain relief resulting from services delivered by doctors of chiropractic may allow patients to use lower or less frequent doses of opioids, leading to reduced risk of adverse effects. These authors consider the benefits of receiving chiropractic services for both reduced costs and reduction of opioid use to be impressive. It's nice when a researcher says, wow, that's impressive. That means there's some significance to that. Chiropractic care uses the same receptors as do opioids and opiates, providing profound pain relief, but without addition, death, and other side effects. Compared to primary care physicians for management of acute neck pain, chiropractors are the second most sought after, and it lowers rates of opioid prescription, advanced imaging, lower referrals for injections, and lowest use or referrals for surgeries. In fact, it was 0 in that analysis that they did, which is pretty great. Chiropractic spinal manipulation is considered to be the best non-drug evidence-based approach to be thoroughly vetted for treatment of chronic pain. So know that when you are getting your chiropractic care and getting adjusted, it is definitely managing your pain, but it's bringing you greater levels of vitality and health. It's really putting you on a different trajectory in terms of what you experience in the world. It's changing your trajectory for what 10, 20, 30 years look like down the road. We find that chiropractic is great with pain. But once the pain goes away, that's where the work really starts. And that's where it's really challenging, because guess what's a great motivator? Pain. Pain is a great motivator. And I can't tell you, how many people we see who walk in and out our doors who say, oh, I was on board with it then because I was at a 9 out of 10 pain, but now I feel better, I'm done. I'm like, this is the time to double down and really be consistent with the care. I have somebody who, like, chronic pain, 10 years, and he finally said, okay, I'm going to turn to some pain meds and opioids. And he said it literally took his pain away, like 0 to 10. He was like 10 out of 10 for like 10, 12 years. He's like, oh my gosh, I haven't felt no pain. I can't even remember. And now now it's like he's got disc herniations, he's got major back stuff going on. He's like, I gotta stop or reduce my care. And I'm like, you don't even know and feel what your body feels like. You won't even know if you hurt your spine, when you're on these pain meds. So it's a big motivator, and that's where we got to be that much more diligent to be consistent with the choices you make. Chiropractic care or otherwise, the foods you eat, the movement that you do, the posture interruptions, how you work and stand at your desk or sit at your desk, how you find balance in work life, how you find joy and get outside, all of those things. So let's talk about this. There's alternatives to NSAIDs. Turmeric or curcumin, which is a spice found in curry, typically I don't have this written down, so a more therapeutic dosing for turmeric is around 2,600 milligrams. Boswellia, it was an extract from a tree in India. Bromelain, which is an enzyme found in pineapple. White willow bark, which is what aspirin is, aspirin was based off of. Precursor to aspirin, but without the GI side effects. Green tea, it's a potent anti-inflammatory and antioxidant. And then I got some things to say about fish oils. The agent best documented by hundreds of references in the literature for its anti-inflammatory effects is omega-3 fatty acids found in fish and pharmaceutical grade fish oils. There's some great studies out there showing how omega-3s and fish oils compare to actual pain medications. And they found that, pretty significant results. 78% of, let's see, let me make sure I'm reading this. So these are patients, 250 patients, so a small study. who'd been seen by a neurosurgeon and were found to have non-surgical neck or back pain, but were asked to take a total of 1,200 milligrams of omega-3s daily. 78% were taking 1,200 milligrams, 22% were taking 2,400 milligrams of fatty acids. And after an average of 75 days on fish oils, 59% of them discontinued taking their prescription NSAID medications. And 88% of them stated they were satisfied with their improvement and said they would continue taking their fish oil. Takes a bit though, 75 days. That's 2+ months of being on a fish oil before you're really, changing that. You go back to anti-inflammatories. What is that doing? It's stopping that arachidonic, acid cycle, right? Which is pro-inflammation. Let's see, this one. I don't know. I'll give this handout to you because there's a lot of really great things in terms of omega-3s. But I would say that one thing that is going to be most supportive in terms of your brain health is taking a fish oil or omega-3. And if you are in pain, then you can do some more specific dosing as far as helping address your pain over time is a fish oil. You can do all of these other things. They are available to you without the side effects, which is nice. Another alternative to NSAIDs are CBD oil. Can be an effective pain reliever, fights inflammation, nociceptive pain, which is pain receptors in the body, neuropathic pain, in joint pain, aromatherapy, which are essential oils, which is lavender, rose, bergamot, frankincense, peppermint. I think next week or the following week, Doc's going to be talking about how essential oils can help support your health and health regimen. So we'll get into that. And then I forgot to finish this. Formula 303. That's something we have in the office. And you can get this. You can get this on certain sites, but this is Formula 303. And it's made up of valerian root, and it's specific to help bring ease to the body, relaxation, and it can be great in terms of pain relief. So some people swear by this. They love it. And it's just a natural supplement and blend that without the side effects. So this is something here. So there's a lot of, I think, options out there that are alternatives, but it's not necessarily going to pack the punch that an NSAID does right away. And especially if you live a really inflammatory lifestyle, you're constantly consuming foods that are, inflammatory, and you're moving your body and you're unhealthy in how you move, and you're carrying extra weight, and you're working 60 hours a week. I mean, you can add up the lifestyle stresses over time that, an NSAID, it's targeting boom, and it's creating a change right away. These lifestyle components, you may not notice it right away. It takes time to shift the body into a healthier state. That's the biggest thing I think both Doc and I will agree on, is that what is the biggest factor to really, turn a ship around or just start to create more vitality and support in the body is time. Because it took years and decades to get to, each of our states of health. So anyway, I've got a lot of great, here's some of the resources. This Green Med Info, I really like them. They are one of the, here, I'm just going to close this down and show you Green Med Info. I'll let you guys, let's go here. And then I'm going to call it good, because I know I'm going over. Let me share with the Zoom folks here. So this is a really great search engine that covers tons of research out there related to all things natural. And if you want to just type in, I don't know, natural pain relievers, they will cite the studies for the aromatherapy and say, here's what we found with cancer patients using lavender. They actually have all the the research cited there. And it's a great place to start if you're just wondering what would be a natural approach for, you know, me to maybe dive into some pain relief using white willow bark. You know, what are the studies out there? What's the studies out there if I want natural pain relief for migraines? They had one that talked about magnesium. What are the studies out there for osteoarthritis for a knee? Is there anything specific that we've seen in the research that helps address that? So I really like this search engine. Oh, and Colleen. So Doctor 9 years ago put me on CBD after I was diagnosed with tonsil cancer, and it was one of the best things to help with sleep. So I think, thanks, Colleen, for your personal testimony. My hope is, as we're just talking about the conversation around what is traditional pain management, I just hope that you're hearing something different and know that there's something else out there for you that won't cause as much stress in the body that we see some of these pharmacological modalities do. So where I want to leave it here is, it is our Patient Appreciation Week next week. If you learned anything from this workshop, is that there's a lot of people in pain, and that chiropractic is great with supporting pain relief. And so what we do for a Patient Appreciation Week is you can refer anybody in, and they get the initial exam at our expense in totality, including x-rays. And it includes that follow-up report where we go through, this is what we're finding, this is how it relates to your goals, and this is what we can support you with in terms of lifestyle changes and health. So we still have 4, I think, spots available. We have 3 spots available. So one Monday afternoon, Wednesday afternoon, and Thursday morning. You're welcome to, we ask that you send in your people who are in pain or just want to experience a higher level of health. At least they'll know the information. We're not asking them to sign on for care. We just want to support a more informed consumer. So thank you for being here. We appreciate you. For those of you on Zoom, if you can just hang out, we can make sure you're on the list. Otherwise, happy to hear any questions you have in the office, give you my resources, all of those things. So love you, appreciate you, and we'll see you next time.